My name is Shayla, and I will be exploring the limitations and barriers to healthcare that transgender people face and what the implications of this are. To begin, in order to understand how much farther we need to come and how the past can still impact transgender people today, a brief history is necessary. This history begins with Magnus Hirschfeld, who created the term transvestite as well as the adaptation theory, which made it possible for transgender people to live as who they feel most comfortable. He also performed some of the first sex change surgeries for transgender people. However, Nazis soon destroyed any notable historical advancements from Hirschfeld's Institute for Sexual Science. Transitioning to the United States, their first gender realignment surgery wasn't until 1952. However, this lack of treatment and available doctors here meant that any follow-up procedures had to be done in Denmark. Then, in 1966, the transsexual phenomenon was published, changing the way of healthcare for good for transgender people. Its author advocated for things such as hormone therapy and gender realignment surgery. Then, the Standards of Care for Health of Transsexual, Transgender, and Gender Nonconforming People was published thereafter, which gave a guide for physicians to follow on how to treat patients and the variations of problems and therapies that come along. Then, in 1980, gender identity disorder was added to the DSM. This caused people to think that transgender people had a mental disorder, and it made it harder for them to gain access to healthcare. By the way, this wasn't officially changed until 2013. Lastly, in 2014, laws were finally changed to make it so that Medicaid had to pay for gender realignment surgery. After that, it's clear to see that how much transgender people had to go through just to get gender-appropriate care, as well as how much farther we need to go. However, within the last few years, the United States has made some significant improvements to healthcare so that transgender people are able to be treated like every other patient. According to the National Center for Transgender Equality, under Obamacare, aka the Affordable Care Act, it is now illegal for any kind of sex discrimination by healthcare providers or insurance companies. This not only gives transgender people legal protection, but it also allows every state to have options for transgender people to get quality, affordable, and equitable health care. Now, this sounds amazing that there should be no problems from this point on, but this simply is not the case, as continuing these protections are going to be a battle, as evidenced by these protesters. To begin, there are different laws for private insurers that leave coverage of transgender people up in the air. This graphic from the Movement Advancement Project shows just how significant the variations of laws regarding insurance for transgender people are from state to state. Along with this, under the current administration, the Affordable Care Act, which prohibits discrimination of transgender people and allows them access to care, is now on the balancing block. Just this year in April, a case called Franciscan Alliance versus Azar was brought by Texas, a conservative state, to the Supreme Court to try and get Section 1557 of the Obamacare taken out. This section prevents sex discrimination, so if this is taken out, all LGBTQ plus people will be affected, as there will be no legal protections against discrimination of them in healthcare. Also, even if legal protections are maintained, this does not automatically erase all the stigma and homophobic tendencies that are still alive in the healthcare field. In an emotional excerpt from Trans Bodies and Trans Selves, the author explains how hard it is to be transgender in the healthcare system. They state, many of us have delayed or avoided healthcare and health maintenance screenings because of negative interactions with the healthcare system. We have been asked to fill out forms with boxes that do not describe us. We have been called names or pronouns that are accidentally or deliberately incorrect. We have been assigned to inappropriate hospital rooms, and the list goes on. So although denial of access and discrimination may be illegal in most cases, it does not prevent the occurrences from this happening and making trans people less likely to access healthcare willingly. According to the Commonwealth Fund, because of this past stigmatization and harassment, 28% of trans people report avoiding healthcare altogether. This shows that past experiences have already made their mark and tainted the healthcare experience for transgender people. On top of this, doctors are barely even trained on how to provide quality care for transgender patients anyway. According to the American Psychological Association, the lack of culturally competent healthcare by providers is an obstacle in getting better care for transgender people. So along with changing the laws to protect transgender people, we also have to change how we're training our doctors. So, what would better access to healthcare really do for transgender people? Currently in the United States, 46% of trans men and 42% of trans women have attempted suicide at some point in their lives, compared to 4.6% of the general population. If transgender people have better access to healthcare, then their mental health will increase because they will actually have access to receive hormone therapy, gender realignment surgery, and many other things that they want. This is even shown in the infographic below from Feministing, where they have the statistics to prove how substantial access to healthcare can be for a transgender person. In some cases, it can even mean life or death. So, while the United States has made significant improvements to widen access to healthcare for transgender people, we still have a ways to go. Thank you.